Okay, it's gone live. So I don't know if anyone's gonna get the opportunity to join my live stream. But the last couple of weeks, a few really big things have happened, but in between, not a lot else. So although I have been filming, my weeks for my normal updates and stuff, I thought that coming on and talking to you might be a little bit easier because just some really big things have been going on. Hi Kirsty, how's it going? Oh my gosh, we've got 2 watches. That's crazy. Yeah, so I will start with some of the smaller things first. But I went to see a specialist who was just super inappropriate to me the last few weeks, and I'm just at a loss to be honest. Okay, so some of the small things that happened were Vinny, my boyfriend, who is in the vlogs that you see, actually became my registered carer, which is pretty good because he does a lot for me. Especially recently, he's been putting me in and out of the bath, feeding me. A lot of things that a 24-year-old really wouldn't be doing for their girlfriend. So he's now been recognised by the government as my carer because he is here 5 days a week doing things that you wouldn't expect. I passed my theory for my driving test. I had a medical and it was agreed that I was fit for driving. I've just passed my theory, passed it first time, which I'm really surprised about, to be honest. Especially with all the medical stuff that's been going on. This is really good news. I finally got that blood test I was talking about. I was meant to have a vitamin and mineral test. Thanks, Kirsty. Thanks, I'm very pleased. Yeah, I was meant to have a vitamin and mineral test, but my GP is, to put it nicely, she's hard work. When I first started to see her, she didn't believe that I had EDS. She thought my mother was a hypochondriac, and that all my problems was just like made up and in my head. When it finally turned out that I had EDS, she kind of backpedaled a bit and was a bit like, "Oh yeah, sorry, it's really rare." So obviously, we don't see it a lot, but I really haven't trusted her much from then on. And she's tried to be nice, but she showed her true colours. So I asked her to do this blood test, and she didn't. She did a blood test that she felt was necessary. For a while I've been saying there's something wrong with my vitamins and minerals, like someone needs to check this out. And we finally had it done, and the next day I got a phone call from my GP telling me that my vitamin D was dangerously low. So the level, I actually have the results here, the levels that you should be between, which is a healthy range, is 75 to 150 nmol. I have no idea what that measurement is. Mine was 16, so that's really, really low, and indicates a vitamin D deficiency. So vitamin D deficiency can actually make joint pain worse, can cause severe pain, so that was just great. She's put me on a vitamin D supplement, 20,000 units a day. That's a huge dose of vitamin D, and I have to go back next week to check that my bloods are like not screwed up because of that. So I'm really like not happy about that, and also my folate came back as borderline low. So I'm, to put it politely, I'm pissed because I've been telling them for months that something's not right, and they ignored me, and now it's finally come back that there is an issue. Yeah, so that's really not great. A couple of weeks ago, my boyfriend and I, we went out. This is a separate thing. A couple of weeks ago, we went out and we were at a bus stop, and a lot of disabled people probably encounter this sort of issue. People being ignorant and stuff and being rude. I've never really had it to this degree, but we were sat at a bus stop. I was with my cane, and this old lady next to me just started laying into me, and she was like, "Do you feel sorry for yourself?" And I was like, "Not really, no." And then she pointed to my boyfriend and she was like, "Well, he clearly feels sorry for you." And I was astounded. And I was like, no, honestly, I don't feel sorry for myself. My boyfriend doesn't feel sorry for me. And like, it was just really rude. Like, don't come in my space and like lay into me. She started going on about, well, I've got an 8-year-old granddaughter who's got issues, and I tell her to go in her room and just cry because Nana doesn't do feelings. And I just thought, wow, that's really sad for you that you're like that. Oh, yeah. Sorry to hear, mad scientist. People are just really ignorant, and it took me by surprise, to be honest. That people, I think it's okay to ask, and I don't mind people asking about my disability. But who are you to pass comment on? And even if I did feel sorry for myself, I'm allowed to feel sorry for myself if I want to. I don't know. So yeah, these are some of the small things that have been going on the last few weeks. But as far as where my gastric stuff are up to, I've been getting worse the last couple of weeks. I thought that might be the case, Kirsty. Yeah, I thought that might be. Yeah, as far as my gastric stuff is going, it's just horrific. I haven't really eaten properly the last couple of days. Everything hurts, everything makes me feel sick. I got a letter from my gastro for the last test I had done. He made me have a lot done, and it's actually worse than I thought it was. So the last test I had done was to kind of check if my muscles were working properly in my system, and they weren't. But it's actually that there was no activity at all was seen when they were trying to test the muscles. I thought they were just weak. They're just not working at all. And unfortunately, the last couple times I've tried to go to the toilet have just been horrific. I know it's really TMI, but yeah, the last couple of times I've tried to go to the toilet were really bad, and I passed out on the toilet yesterday, which is really embarrassing. So I don't really know what's gonna happen with that. I've been doing a lot of research and reading around and scaring myself silly, and I've seen surgery crop up a lot in message boards for what's happening with this issue. So I need to call my gastric specialist, because he's just kind of, as great as he is, I don't want to like slag him off, as great as he is, he's kind of left me in limbo to just kind of deal with these problems while he's been testing me. So that's kind of disappointing. And we finally get onto the final problem, kind of why I wanted to do this live stream, because many of us have probably encountered doctors that have said something unkind or said something cruel, or they've not understood you. I've had doctors say many things that I just thought that's not really okay to say. I had a rheumatologist tell me that there was nothing wrong with me. I didn't have EDS, and then a year later I was diagnosed with it. So I've seen my fair share of crap doctors, but this doctor takes the cake. Yeah, unfortunately, yeah. So I don't know where to begin. So I have been under a pain specialist from pretty much the beginning of when I got sick, which was 2014, I think. He is an anesthesiologist. He's like the head of the department at a big private hospital. So a little bit of backstory to show what kind of doctor we're dealing with here. He made me once walk back from surgery, which they're not allowed to do. They have to like wheel you back for like insurance purposes. He made me walk back from surgery, and I passed out, and he like didn't put it in his notes or anything. He didn't like tell anybody about it. He gave me procedures that other pain specialists were baffled by, things that he shouldn't have done or given me. And he seems to have this front that he's not going to give me opiates. And I know that in this country there is an opiate epidemic going on, and it's the same in America. Because they used to give them out like sweets, and now, people are addicted to them, and they have to be careful with these medications because you know, it can come back on the doctor and they can get in a lot of trouble. So I totally understand that. But I have been through so many medications with this guy, non-opiates, may I add. You know, I've tried everything he's given me, down to stupid, insane things like chili-based cream. Like, for what chronic condition is that really going to help? I can understand people maybe with a localized pain or an acute pain, but people with chronic, widespread pain need stronger painkillers to get by. My friends with this condition, some of them are on morphine, some of them are on tramadol. This guy is just, yeah, yeah, I know. Yeah, this guy, he is really not into opiate prescription, but you know, I've tried absolutely everything. I've been under this guy for 4 years now, and my pain has gotten horrific. Really, really bad. A couple of times ago when I went to see him, I was in so much pain, I was physically vomiting in front of him in his office. So he knew how severe my pain was. So we had an appointment to go and see him last week. And I wasn't feeling very hopeful that that we were going to get anywhere with it. But I thought, you know, I've got to give this one last chance. You know, I need to tell him how serious this is. A month and a half ago, I haven't really talked about this on the channel because I don't want to trigger other people. But a month and a half ago, my pain got so unbearable and intolerable that I nearly did something very silly to myself. I put myself at risk of, yeah, I did something very silly to myself that nearly cost me being here. And, you know, that's, people with chronic pain sometimes feel like that. And, you know, I went in and I was very honest with him and I told him what had happened. And I said, you know, I'm not depressed. This isn't a depression issue. This is just, I can't cope with the pain. And this day, the pain was just so bad that I didn't know what else to do. And an act of desperation, not depressed, not a problem with depression. Yeah, so I said to him, I think anybody in my situation would feel like that, waking up in the morning with chronic pain, having the whole day, going to bed in pain. There is no part of the day where there is no pain involved, and that is a very tiring, draining thing to live with. I think anyone would feel like that. I'm really sorry to hear that, mad scientist. It's very common with people with chronic pains that they feel like that's the only option that they have. You know, there are people that go to other countries to have euthanasia because they can't cope anymore, and I think it's a really sad thing that the medical professionals let them down that badly. But I was very honest with him, and I thought, you know, if this doesn't get him to take it seriously, then nothing's going to change his mind. And he was a bit inappropriate and said, well, we all have dark nights of the soul, whatever that means. And he was like, when I told him, instead of being really sincere, he was like, oh, I'm sorry. A bit like, you know, they've kind of not held a door open for you or something. Oh, sorry. You know, like it wasn't sincere. There was no, oh, sorry, Kirsty. Yeah, there was no sincerity there at all, which I thought was a little bit odd as a doctor anyway. Because hearing something like that, you're clearly not doing your job if your patient is turning to things like that. So he was very kind of passive about it and not really that bothered. And he was like, you know, if you feel like that again, you can just come in and see me and we can have a chat. And I just thought, that's not what I want. And I'm not going to trek 40 minutes out of my way to just come and chat to you about feeling like I'm at the end of my rope. And then this is where it gets really inappropriate and it makes me really upset still. Not upset, angry, really angry. He turned to me and said, Becky, have you ever self-harmed? And I told him that I had when I was a teenager. I don't condone it now. What I was dealing with as a teenager was purely a psychological issue. It was a depressive sort of act. But I haven't done that for years and years and years, and I'm really proud of myself for not doing that. And I don't see the point in me doing that now. So I was very open and I told him, no, I don't do that. I have, but I don't. And then he turned to me and said, do you think it would help? Do you think it would help? That was the advice he was giving a chronic pain patient. Self-harm, go self-harm. And I looked at him like, I can't believe you just said that. You're a medical professional. I can't believe that that's the advice you're recommending. And I told him that under no circumstances would I think that's an appropriate thing to do. I'm in enough pain as it is. Why on earth would I inflict more pain on myself? God only knows. But I was absolutely furious. I just thought, what a disgusting, despicable thing to say to someone who's in such a vulnerable position anyway. Why even suggesting something like that would be a good thing, I don't know. Obviously, I like to think that I'm not a massively impressionable person, and I'm definitely not going to be taking his advice. But it makes me upset that there are people who are paying to see this guy because he's a private doctor. There are people paying for this service, and this might be the advice that he's giving. He is a pain specialist. And he's saying that he has no answers, nothing to give me. He won't touch anything strong, and his advice is to go and cut myself. So I'm just reeling from. So I came out of the appointment. He basically said, "There's nothing I can do for you. You can come and see me in a month, and we can have a chat, but I can't do anything for you." He said, "Oh, I can give you some more of that chili. Oh, I can give you more of that chili-based cream." Oh, you're just insulting me now. So I came out and I cried all the way home. Not because I was upset, but I was just so angry that someone felt like that was an appropriate thing to say to someone that was in pain. I don't. And then I rung my mum, and my mum was just as appalled. And we have put in a complaint. I'm going to read you what we wrote in the letter, because this isn't the first thing that this doctor has said that's really inappropriate. But I am at a loss. Like, it's definitely the most offensive thing someone said to me. So let me find what we wrote. So far, nothing's come back, to be honest. They've just confirmed that they've had the complaint. My mum actually rung pretty much as soon as it happened, and the secretary who picked up was really upset by the comment, and they went away to speak to the doctor. He at first denied saying anything at all about self-harm, which is just ridiculous. I can't even believe that he would deny that. And then he came back and said, "I'm sorry that you're upset." So not really an apology at all, but I can't. Let me see if I can. Oh, there we go. Is that it? Okay, so this has gone to the head of the hospital, and if this doesn't go anywhere, then we're going to take this further, because I don't want him saying that to someone else. It's just appalling. So my mum wrote this, and I'm going to obviously redact his name because I don't want to get in trouble. Okay, so further to my conversations with Dr. Redacted's secretary, I feel I must write a complaint in the strongest terms about what happened to Rebecca's appointment today with Dr. Redacted. I think it's best if I lay out the facts for you before detailing the questions we want or the answers taken. Rebecca has a diagnosis of Ehlers-Danlos syndrome, and then we found a quote which says EDS may be the most common genetic connective tissue disease to cause intractable pain, necessitating in high-dose opiate therapy. And we kind of included where we got that. It's from a medical journal. Part of this condition manifests itself as an insensitivity to many medications, which is true, and a lack of any pain response to local anaesthesia. Rebecca has experienced both these issues as documented in her notes. Since Rebecca first saw Dr. Redacted in 2015, she has been prescribed the following pain medications with no avail whatsoever. So this is the list of things that he's given me, and none of these are opiates. So medroxyprogesterone, Zoladex, amitriptyline, nortriptyline, pregabalin, gabapentin, duloxetine, a bilateral nerve block, which is the surgery that I had where he made me walk back from the surgery and I passed out. Also, he gave me a local anaesthetic and it didn't work because it doesn't work in EDS patients. And instead of trying to get me comfortable, he just did it anyway. And I felt the whole thing. It was just one of the worst pains. It was just horrific because he had to get right deep in the vein, like really thick vein in my pelvis. Not a great experience. Cocodamol, codeine, tapentadol, Vicodin patches, which is a local anaesthetic on a plaster, chili base cream, desogestrel, and sumatriptan. At a previous appointment at which I accompanied Rebecca, I told Dr. Redacted that Rebecca had resorted to smoking marijuana at university, true, as nothing he had prescribed had worked. He stated that he had tried everything that he could, not the case, and found that several of his patients found relief in smoking marijuana, and if it worked, then why not keep on doing it? I made it clear that this was an unsatisfactory response. So marijuana is illegal in this country, and a lot of pain patients will turn to it, but he's not doing his job effectually, so I shouldn't be criminalising myself to find pain relief because he is a bit stubborn about using opiate. Rebecca has been referred to a pain management clinic and they felt her unable to participate in the programme as, ironically, she's in too much pain, which is still true to this day. I'm not well enough to participate. It's just a vicious circle. Today, when Rebecca attended Dr. Redacted's clinic, she informed him her pain is now so bad that she recently attempted suicide. Rebecca is under a different team who supported her psychological needs, and Rebecca told Dr. Redacted that it was not depression that caused this, but rather her chronic, unrelenting pain. Dr. Redacted has witnessed this, as Rebecca has literally vomited with pain in his office on another occasion. On that occasion, he sent us to A&E as he felt he could not prescribe anything to help. Today, Dr. Redacted seemed sympathetic but somewhat dismissive, stating we all have dark nights of the soul. I do not feel this is an appropriate remark given the circumstances. Again, he suggested Vicodin patches, despite the fact that EDS patients do not respond to local anaesthetic and despite the fact that this has already been tried. The next part of the conversation went like this. Dr. Redacted, have you ever self-harmed, Becky? Me? Yes, when I was younger. Psychological issue, but I haven't self-harmed in years. Dr. Redacted, do you think it would help? Whether this comment could have been misconstrued or not, it was totally inappropriate for a doctor to say this. Consequently, Rebecca is extremely upset and does not feel like she could come and see him again. Oh, that was another thing he said. I could come back with my mother and discuss the situation if I wanted to, but in what world would I ever want to be in the same room as that man again? I don't know. My mum also said, if he would like to ring and apologise on the phone, then I can put it on speakerphone and she can hear. And he said that wasn't appropriate. He wasn't going to do that because of confidentiality issues. And I just thought, what confidentiality issues? While we can appreciate there is a reluctance throughout the sector to prescribe opiates for pain, Rebecca is part of a much wider EDS community in the UK and is aware of many patients who have been successfully treated with opiates. My own auntie has been treated with opiates for chronic pain. It's not like they won't prescribe them, it's just that he obviously looks at me, thinks I'm so young and is not going to do it. So I should mention that this wider community is horrified by Rebecca's experience today, and there have been many suggestions to report this to the GMC, which is like the medical council. That's where you would go if there are issues. So if we don't hear back from the hospital, then that's obviously where we're going to have to go. I posted in an EDS group and everybody came back with the same, just discussed what the hell is he on, what kind of medications he taken to be suggesting things like that. We don't particularly want Rebecca on opiates, but clearly have exhausted all other options, and his alternative is that she just lives with it, and that's clearly not satisfactory. It's also worth mentioning, given the fact that we're now 4 years down the line and Rebecca is still in chronic pain. I don't want you to think Rebecca has been uncooperative in what she's tried for her pain. She's also tried the following: acupuncture, Pilates, swimming, CBD oil, physio, binaural beats, KT tape, CBT, vitamins, minerals, cold compressors. You know, I've tried a lot of alternative therapies, but this guy, it's very disappointing and frightening for a chronic pain patient to essentially be told, sorry, there's nothing we can do. Do you want to try the chili cream again? But it's far worse for a doctor who is supposedly taught to do no harm to make a reference to self-harm that could be construed as a suggestion. We would like you to address the following: an explanation for Dr. Redacted's comments, an apology, not a qualified Dr. Redacted is sorry if you're upset apology, that's not an apology. Transfer to a different pain specialist, an appointment with that specialist to address the ongoing chronic pain caused by Ehlers-Danlos syndrome. So that's gone off to them. They received it. They want me to write a letter now giving them permission to talk to my mother, even though my mother wrote the email with me, and, you know, just sick of this hospital. This is also the hospital where a gastric specialist told me there was nothing wrong with my results for a specific test, and it was actually 12 times higher than it should have been. So this is a private hospital, which just astounds me. This is a private hospital. People are paying for this care and this advice, and I just I don't know. So I don't know what you guys would suggest if you've had this sort of behaviour from a doctor or, you know, a so-called specialist, but that's where we're at. So the last few days I've been in this like weird mental state, like I don't know. Yeah, so the last couple of weeks have been eventful, but in short, sporadic bursts, if that makes sense. I'm still going to obviously continue this channel because I really enjoy making these videos, and I really enjoy the friendships that I've struck up with some of you guys. The support that you give me, really, like, it makes me feel good on like my really bad days, which seem to be more and more, unfortunately. Yeah, so I spoke to my physio the same day that happened, and I was just obviously distraught, and I told my physio what had been said, and he just couldn't believe that a professional would say something like that. I don't know. So I guess that's kind of really where I'm at the minute, but I will be posting videos soon. I'm going to try and do my wheelchair review. I got a rollator to test out. Let's see what that says. Oh, wow. Yeah, we're really lucky, David, that, lucky. We don't necessarily pay over here in the NHS. You can go private, which this doctor is, and pay hundreds for a consultation. The NHS is free because you pay through your tax, but that's crazy. Yeah, some of them, they'll do anything for money. They don't care. Like, they see you as a paycheck, and that's really, really sad. You know, this Dr. Redacted, he drives this really fancy car with like his personalised number plate. He actually walked into my appointment 15 minutes late. I think I saw him walk through the door like 15 minutes late. Just no sense of urgency, no sense of, like, he just doesn't care about his patients. It's really sad. Yeah. So obviously I will keep you up to date with what is happening with the case. There might be some things I can't tell you during the time, like if it legally I might not be able to talk about, but rest assured that I will I will definitely let you know what the end outcome is from this situation. But I'm really, really unhappy, and I'm definitely not going to stand for that, and I'm not going to let other chronic pain patients have to deal with someone like that, because that's disgusting. Honestly, my thoughts are he'll probably get a slap on the hand, but you know, putting in a formal complaint is better than not putting in anything. So we will see. So Yeah. Anyway, yeah, I'm gonna upload soon. I did a box swap with my really lovely friend Kirsty, a care package, which I've actually done the channel before. It's where chronic pain patients send each other packages. I was blown away by the amazing things that she sent me. It came the day after that incident as well with the doctor, so it cheered me up no end. So I'll post that soon. I got a rollator from a company to trial, so I will show you that as well. I'll do my wheelchair update and life living with a wheelchair. And also my friend Kirsty asked if I could do an experience video about going to Disneyland with a disability. So I thought that was a really great idea. So yeah, I think that sums it up. It's been really nice being able to interact with some of you tonight. Thank you so much if you tuned in. I'm really grateful for everyone that comments and supports me. It really makes me feel good. But yeah, I'm going to advocate for us disabled community, because no doctor should talk to anybody like that. It's just appalling. So yeah, I think I'm going to go now. I can feel a massive migraine coming on. I was off work yesterday because I passed out on the loo. Not nice. But I definitely wanted to come on and talk to you guys. So I think that sums it up for this evening. Hopefully we'll see you really, really soon back on my normal videos. Take care. Stay safe. Oh, it's been great. Thank you, David. Yeah, it really has been cathartic. It's nice to get it out. Anyway, yeah, take care, stay safe, and I'll see you really, really soon. Bye.